Christy Reed joins us at the Las Vegas facility to tell us about her experience at the Bonati Spine Institute.
I'm 44 years old. I live in Las Vegas. I've been married for 17 years. I have 2 teenage daughters. They're both in high school as a freshman and a junior. I have 2 dogs. I work in sales. I love to travel, love to read, watch movies, spend time with my kids.
In 2015, Christy suffered lower back injuries after being rear-ended in a car accident.
The pain actually started with just an ache in my lower back. It felt like I had strained my muscles, my bones in my spine, like my discs. It felt like they were crunched. Then the pain in my sciatica nerve started happening down my right leg. And at first it would just be occasional pain when I would get up from sitting to a standing position, or if I was walking, I would feel it. And it was just like a zap of electricity that would go down my leg. Then after that, it started becoming constant, and it was all the time. And then it just became excruciating to the point where I would stand up and literally scream just in pain and have to grab into something. It was like I was being electrocuted all the way down from my lower back, all the way down to my foot, to the point where I couldn't even walk anymore.
And she quickly began looking for help.
When I was experiencing the pain, originally I had seen a chiropractor. I saw a pain management specialist, and finally the pain management doctor just said, "There's nothing else I can do for you."
When pain management was no longer able to help, she saw a surgeon who performed her first back surgery.
My original surgeon did a microdiscectomy on my L4, L5. Just through time, the pain started coming back again.
She returned to her surgeon, who would now recommend a fusion. But after hearing the recovery time would be 3 months, she determined she couldn't go through with it.
So I realized that I couldn't live in this kind of pain, and that it just was not acceptable and it wasn't getting better. The Bonati Institute had advertised on TV. My husband had said, "You know, Christy, why don't you just call them?" You know, I looked on their website, saw other testimonials, read the procedures, watched the videos online, and I realized that, you know, it might be a good option. So when I first called the facility, I spoke to someone in Florida, very nice lady, and she asked me a bunch of questions, asked if I had an MRI, which I did, and so I sent the MRI to her, and she said she would get back to me. And probably within an hour or 2, it seemed, I received a call from the doctor, Dr. Grossmith, personally, who had already reviewed my MRI and had said, "We absolutely can help you," and he would like for me to make an appointment and come on in.
At the Bonati Spine Institute, patients are treated with the utmost respect. The surgeons and staff spend as much time as necessary to make sure the patients feel informed and prepared for their treatment plan.
When I made the appointment for the consultation, I came in and I met with Dr. Grossmith and another surgeon, and of course the nurses, who were all very helpful. And what I liked about Dr. Grossmith is that he didn't use all these big medical words that the common person doesn't understand or know what they mean. My first surgery was on my L5-S1, and they went in to basically open up the area around the nerve, the canal around the nerve, because that's what was causing some of my pain. And that surgery lasted maybe an hour. And I walked out of here a few hours later, went home, recovered. My second surgery was 2 weeks later, and that was on the L4-5, where they again made more room in the disc around the nerve. And then they also took care of the third problem, which was the herniated disc on my L4-5.
Dr. Grossmith sat down with our crew to explain Christy's imagery.
So in this particular case, I'll pull up the MRI. You can see an L5 nerve, and then it looks like there's some change in the bone right here. So potentially an opening that might have been made in the past at that level. But this will be a combination of soft tissue and bone pincering or squeezing a nerve. And so basically the idea would be to go down with the dime-sized tube, land at this level, and re-explore this area, finding out where there's bone and not bone, identifying that so that this can be opened up to get down to the disc, and then remove this disc material while at the same time some of this bone is cut back to make the area larger for the nerve to travel through.
A major benefit of the Bonati spine procedures is the use of conscious IV sedation. This technique allows the patient to be awake during the procedure, assuring the problem is eliminated. So unlike traditional open back surgery, the patient doesn't have to wake up and wonder if the surgery worked.
What was so interesting to learn with the whole procedure was when I was having my surgery and they have you move on the table, my disc re-herniated.
Normally after we do removal of disc material, we have the patient twist or arch and turn for the reasons of making sure that there's no pain going down the leg, the back pain improves, but also by moving like that, if there's any additional disc material, it's the chance for the patient to re-herniate on the table, and we can retrieve those fragments as well.
They had to go back in after cleaning it up the first time and clean it up a second time while I'm on the table because they weren't going to leave me half fixed. They wanted to make sure that they fixed everything in that second surgery. I did not have any more pain other than the incision site, which was a very small incision, but I had no pain. I was able to walk out of the office and I felt amazing, and every day it got a little bit better, and now I'm pain-free.
For those who have been told they can never live without pain after spine surgery, Christy is living proof that is not the case.
So it's been almost 6 months since my surgeries now, and my way of life has returned. So I'm able to work, I'm able to enjoy time with my family. My family and I just took a cruise over Christmas, and I was able to do excursions. I was able to swim with the turtles in the ocean. I was able to, walk the length of the ship. And so it was really nice to be able to finally have a normal life and be able to do things that I used to do before all of this happened.